I'm Dr. Jack Carlisle from Grand Itasca. I'm a family physician, so we take care of the whole family from beginning of life to the end of life, and try and keep people healthy and also take care of people when they're ill. So the colon is an important organ. It might not be the most glamorous thing to talk about. Another name for the colon is the large intestine. So the small intestine is where food from the stomach gets absorbed, all the nutrients get absorbed into the body, and then the colon basically helps to absorb minerals and helps to absorb water, so that you can actually maintain your hydration and those sorts of things. Colon is extremely important for those things, and even though it's not terribly exciting, eating things that are good for your colon is actually a very smart idea. Things that have natural fiber, things like fruits and vegetables, oatmeal and bananas and those sorts of things do help to keep things healthy in the colon so that things kind of move through. Talking about bowel movements is not necessarily something that people are comfortable with, but if you're having trouble with bloating and gas and abdominal pain, or trouble after you eat, or blood in the stool, or black tarry stools, or clay-colored stools, or greasy stools, or those kinds of things, we kind of want to know. So it's not a bad idea to sort of pay attention before you flush, actually, what you're flushing away, because we are going to want to know that if you're having any abdominal symptoms. Water is an extremely important component to this. It doesn't have to be just water. You get credit for soup, or if you have orange juice or you eat an apple, those kinds of things still have water, and that contributes to your overall hydration for the day. Colorectal cancer is actually one of the leading causes of cancer-related death in the world. So one of the things that is recommended is really that we do colon cancer screening starting about age 50. Polyps really are kind of how colon cancer starts. So if we screen for polyps and we find a polyp and we can take it out, essentially we can prevent colon cancer from coming. The gold standard for colon cancer screening is still colonoscopy. If you do a colonoscopy starting at age 50 and it's normal, then you basically get a 10-year pass. If there's an abnormal polyp there, a precancerous polyp, then they usually recommend a follow-up that's a little sooner, somewhere between 3 and 5 years. The problem with a colonoscopy is it's a day off work, it's a prep, and everybody talks about that. You have to drink this stuff that tastes like Gatorade made out of a mud puddle. But some people would choose to do something different, and probably the latest thing that people are talking about is the little box that waves to you from the television in the bathroom, and that's the Cologuard test, which is a branded test that was developed with Mayo Clinic and other places. So you take a stool sample, you send that into the company does an analysis. If there's abnormal DNA, then it doesn't mean you have colon cancer, it just means you need to have a colonoscopy. Yeah, so there's other things besides colorectal cancer as far as colon health, and one of those broader topics would be what's called inflammatory bowel disease, and that's something like Crohn's disease or ulcerative colitis. And essentially those are autoimmune disease where your body kind of attacks the wall of your bowel. Ulcerative colitis usually starts at the bottom and kind of works its way up, and the symptoms of that can be abdominal pain, blood in the stool, mucus in the stool. Most people who have that know this isn't right and there's something going on. Crohn's disease can affect the colon as well, but can also affect the small bowel. With both of those conditions, there are lots of things that can be done, and a lot of newer medicines that can actually be very helpful, and people who have those conditions now can lead a pretty normal life as long as we know about them and find them. So again, anytime you have blood in the stool, anytime you have unusual change in your bowel habits, cramping, bloating, pain after eating, change in bowel habits that aren't your normal bowel habits, are all things you should talk to your doctor about. Grand Itasca Clinic and Hospital, your partner in health.